Welcome to our 5 on 5. Please be joined today by Dr. Peter Adesman, a gastroenterologist. Easy to say, well, relatively hard to spell. Good to see you. How are you?
Thank you. Yes.
So we're talking about National Colorectal Cancer Awareness Month. How common is this?
Well, colon cancer is one of the most common cancers we have. As by the way, because of National Awareness Month, I'm wearing blue, got the wristband, got the little tag here.
Very nice.
And it's a very common cancer, and actually the most preventable cancer among the common cancers. So it's the second leading cause of cancer-related death.
Wow, okay. And so how preventable is this?
Well, it's preventable if we have screening. The estimate from 2017 that there were 135,000 cases of colon cancer that year. And that's down from traditionally about 150 to 160. So screening is making an effort. The problem is not a good percentage of the population hasn't gotten screened. So if you don't have 50% of your population screened, you can only make so much of a dent in the incidence of colon cancer.
What age should people start considering getting screened?
So colonoscopy screening starts generally at age 50 unless you're a high-risk person. For example, if you have a first-degree relative, and first degree is defined as mother, father, sister, or brother, it's recommended that you do it somewhere between 5 and 10 years before the signal case, or what we call the proband. So that person, if you have a brother that had it at 45, we'd probably start somewhere around 40, 35, 40, not waiting till 50, obviously, because of the increased incidence. The incidence of colon cancer in the population is about 6%, but when you have a first-degree relative with colon cancer, that incidence can go up to 12, 14%, depending on the age.
Wow, okay, all right. And are specialists like yourselves the only ones who do these kind of screenings?
No, actually, the nation obviously can't be screened just by gastroenterologists that are obviously the best trained to do the procedure. So you do have alternative surgeons and primary care doctors, but gastroenterologists go through a minimum of 3 years of additional training for endoscopic procedures, and we're the ones that go to the conferences for more of the advanced endoscopic care. So we can do things that are generally not available in the community, especially with large polyps.
Interesting. All right, we're going to take a quick commercial break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Peter Adesman, a gastroenterologist. We're talking about National Colorectal Cancer Awareness Month being March. So what can people do to avoid colon cancer?
Well, obviously, it's unavoidable if you're in one of these high-risk groups that has even a genetic predisposition. There are genetic causes of colon cancer. Familial polyposis, for example, a very rare genetic disorder, 100% of those patients get it. Fortunately, it's very rare. And then there are other family cancer syndromes. But the average patient population, which has a low incidence of cancer, probably 6%, dietary factors make a difference. A low-fat diet would be beneficial in terms of decreasing the risk, and taking an aspirin a day will decrease the risk. Now, these have small effects on the incidence, but they are real.
Interesting. All right. And what, obviously, we know colonoscopy. I'm not sure if it's the most common test, but there are options for people to do tests?
Right. So the first thing you have to remember that any form of screening is better than no screening at all. And so traditionally in the past, what we did was sigmoidoscopy and occult blood, stools for occult blood. Sigmoidoscopy only looks at about 25% of the colon. And one of the things that's actually happened recently is we've recognized the fact that there's been a migration of colon cancer to the other end of the colon, the right side of the colon. And so as a result, sigmoidoscopy became less effective tool. It used to be where 50% of the cancers were within the reach of a sigmoidoscope. That's not the case anymore. The other thing that's interesting, and I'll get back to other tests, but that younger patients are getting it. And so the two trends that we've seen is a push towards colon polyps and colon cancer on the right side, as well as younger patients. Now, the traditional screening of sigmoidoscopy and occult blood is still a possibility. These days, there are some newer tests, and one of them is called Kola Guard. You see that advertised on TV quite a bit. The thing to remember about Kola Guard, it is not for people that are in a high-risk situation. If you have inflammatory bowel disease, if you have a first-degree relative, if you're at increased risk, that is not the test to do. But for the average patient, it's not an unreasonable test and certainly better than nothing. As people get older, the false positives increase, and that could be a problem as well. The thing to remember is that if you do Kola Guard and you have a positive test, you're no longer eligible for a screening colonoscopy. So screening colonoscopy is available every 10 years, and that doesn't go against your deductible. It is a service that can be provided that is not against deductibility. Once you have a positive test for a Kola Guard, it now becomes a diagnostic rather than a screening exam. And so deductibilities and other insurance factors come into play.
Wow, yeah. Okay, good to know. Thank you so much for being here. Appreciate it.
You bet.
All right, stay with us. We'll be right back.